Leaked documents show West Coast Health has proposed closing its weekend and after-hour GP clinics and using telehealth services instead. The proposal states high workloads and recruitment issues in the region have put pressure on primary care practices and their staff, and the expectation that clinicians will work a full-day shift and be on call on weekends and after hours or operate a walk-in service on weekends is no longer sustainable. In the document, West Coast Health says an alternative model was needed. It proposed all West Coast practices adopt a telehealth service provided by Aotearoa Telecare National Rural Healthcare Service as the main after-hours and urgent care provider. Patient Voice Aotearoa Chair Malcolm Mulholland described the proposal as a recipe for disaster, and he joins me now. Malcolm, a very good afternoon to you.
Hi, Leah.
Nice to talk again. What are you concerned about with this proposal, Malcolm, of a telehealth service for after hours and urgent care?
I just don't think it's the silver bullet that's going to solve all the woes when it comes to healthcare on the coast and after hours. You've got an ageing population with very limited cell phone and internet access, and that access is vital if you're only going to rely on the telehealth service. There are a number of black spots along the coast where people can't get cell phone or internet, and the idea of asking someone who's, in their twilight years to go along, find a place where they can get the internet and dial in, to me just won't work.
Yeah. West Coast Health says that they've got huge workloads and recruitment issues for the region. So if there aren't medical staff available, though, Malcolm, what can they do?
Yeah, I mean, look, I actually think it is a bit of a resourcing issue. And what I would say is that telehealth does have a place, I think, in particular in the more, popular centres. So we're talking about Westport, Grey, Aotearoa, maybe Reefton. But outside of that, that's where I have the big concern. And I think what they have to do is come up with some creative solutions where if you are in a black spot, what's the next best available option? I have absolute sympathy for doctors and nurses who are working their behinds off and then get to the end of the day and have to provide after-hours service. I get it. But there's got to be a better alternative.
Would there be maybe they could think about using emergency care hospitals like based at Westport or Fox Glacier to transport patients, like having or keeping some clinics open after hours? Is that something? Yeah,
I think there's definitely merit in that, especially in the more geographically isolated places. So you probably are thinking a lot about Westland, and I would also probably argue Karamea, which is about an hour and a half to Westport and then 3 to Greymouth. There are only 2 hospitals on the coast that provide, if you like, ED care. One is Grey, the other is Westport. The problem that we've got in particular, well, with both, but in particular with Buller Hospital and Westport, is that at times they've had to close their services because they don't have enough staff. So there haven't been doctors and nurses on call. Then the community have been encouraged to call St John. The unfortunate thing there is St John's normally occupied carrying people between Westport and Greymouth, and there's only one ambulance servicing that area. So, again, what do people do in an emergency situation?
And you mentioned, Malcolm, that there is a place for telehealth care, but in this area, particular, part of New Zealand, there are not good cell services or people being able to get on the internet reliably. So surely they must have, when they're thinking about this, even if it's just a proposal, haven't they thought, well, hang on, we've got an older generation, we've got some real black spots here. People might not even be able to get onto the telehealth service.
It would appear from reading the document they haven't. They're very clear that this is about replacing every community clinic that supplies a GP or a nurse with telehealth. So unless you live in Westport and Greymouth and you can get to ED, and that includes Aotearoa and Reefton, again, areas where, there is a significant population in Aotearoa, they're going to be reliant on telehealth.